Carlos J. Cardenas, MD, Chairman of the Board, DHR Health.
Dr. Cardenas, can DHR run a robust residency program without a medical school partner?
That's how we started. So the answer to that is absolutely.
Tell us how you're going to do it.
Already doing it. We've already done it. We began that way when we founded the first internal medicine program here at DHR Health and graduate medical education that included general surgery, OB-GYN, and family practice, and then built the fellowships on top of that with all of the faculty, the majority of the faculty being made up of DHR Health medical staff members, and those same individuals are the ones committed to moving our programs forward. I find myself in a tremendous position to be program director for internal medicine, of which I'm very proud to be doing. And you know, there's times in your life that you go through things you'd never done before, like a site visit for ACGME, which is the American College for Graduate Medical Education, where we get our accreditation, and wasn't sure what to expect until we did it, and then we came through that flawlessly with no citations and a commendation from ACGME, which I think was tremendous. Just awesome. And as you build the cores, then you can rebuild the fellowships, and it is my expectation that we will be doing that as well. And our faculty is excited. Everyone's excited. Certainly we have tremendous clinical material. We've had it from the beginning. That's what made it possible to bring a medical school.
And we spoke about this earlier. The folks in Starr County are going to be rather pleased with this news.
Oh, I think it's tremendous. The outreach to Starr County makes sense, like we've had from the very beginning. I personally have been going to Starr County for many years. And it's one of those times that I truly get to enjoy doing what I do as a physician because I'm there doing nothing but practicing medicine the entire day, and so I truly enjoy that, and it's a shot in the arm every time I go.
Are there other hospital systems around the country that have residency programs that are not affiliated with medical schools?
I know that there are community programs, some here in Texas that were founded that way prior to their affiliations, and they were doing very well on their own. Scott and White Memorial Hospital, prior to their mergers and other affiliations that came, it's where I trained. And at the time that I trained, I think they had either just joined into an affiliation but had been without an affiliation with any medical school prior to that. And so, I mean, the example is there and has been there. Community-based centers, community-based hospitals is how healthcare is delivered in most of the state and most of the rest of the country. It's where the rubber meets the road, and those that are in clinical practice and want to give of themselves to volunteer to teach can pass on very valuable lessons to those that come after us.
So none of these accreditation bodies have been phoning you to get reassurances or anything? You haven't had any concerns on that side?
Not at all. We stood up all of our programs in record time. With site visit after site visit and passing each of those site visits. And so I'm very excited about the future as well. We are, by the end of this week, we'll have submitted our applications for fellowships in internal medicine subspecialties and hope to be able to hear something about that by September, but we'll see.
Have you got a goal, a number of residency slots in mind, a target figure?
So I think the number that comes to mind is somewhere in the neighborhood of about 130 that we have, that are what we have today. And as we move forward, you know, there may be opportunities to look for grants and those types of things that would make it possible to expand and do more. Again, none of us lives in a vacuum. It's important that community-based centers, community-based programs, as well as academic programs continue to find like paths to be able to work congruently in search of better health for all of us. And that's really what this is all about. What I really find particularly fulfilling is that you and I are even having this conversation about this. When all of this began, it was all a dream. And so the truth is that you can dream, and sometimes dreams come true. And to be able to have a vision and see it to fruition is truly amazing. And that's a testament to the people who work every single day here at DHR Health, caring for our patient population and our community at large, as we continue to focus with the energy that we take from the bedside to the greater bedside, which is our community, and taking the tools that we have and we have learned from patient care and providing it to the community at large to advance the community and affect the transformational change that is occurring in healthcare in the Rio Grande Valley that we are leading.
How do you find the students? How do you do your outreach? How do you tell people about, one, the Rio Grande Valley, and two, DHR Health?
What's really fascinating is that they don't appear to be having any trouble finding us. When we announced that we had achieved our accreditation, I'll use this as an example. When we announced that we had achieved our accreditation in internal medicine, we had more than 1,000 applications for 12 slots in record time.
From all over the country?
From all over the world.
I think that answers the question, doesn't it?
Well, I think it's also a testament to how connected we all are in this era of social media and all of the other things. And so many people talk about all of the some of the negative things that come with that. Well, here's a positive, that we're connected, and the word gets out very quickly that you have training slots available, and the next thing you know, you have people knocking at your door. And the caliber and the quality of the candidates has been tremendous. And we worked in very rapid fashion to be able to fill our 12 slots in the first year class of internal medicine. It was just tremendous.
And you could replicate that across the other programs as well?
Exactly. So I meant that in total, I mean, for the different programs, because all of the other programs are going through the same thing that we were going through in internal medicine, but and that's because we're going through the off-cycle time, because we're getting ready to participate in the 2024 match cycle, and then we'll be our own institution and our own program during the 2024 match, and then that process is a bit more formal, as all of the participating institutions from coast to coast participate, and we have candidates from all over are able to apply and go through the regular match cycle.
Those are all the questions I had. Have I missed anything? Anything else you'd like to say about your residency program?
Just to say that I'm very excited about this opportunity to teach the next generation of physicians. With it comes, I think, the infrastructure that one needs in order to effect transformational change in an area that so definitely needs it, to help bring equity and parity to the delivery of health care in an area like ours.
And we should say, as the statistics show, 60% of those residents will stay pretty close to where they were learning.
And that's the positive side as well, and that's how you build. You have to help think of it as growing your own, and that's tremendous.
Dr. Cardenas, thank you so much for today's interview. We've learned a lot.
You're welcome, Steve. Thank you.